There are several types of anesthesia that can be used to perform a penile implant. So you can have general anesthesia. General anesthesia means you have a tube in your throat and that you're on a respirator. So in my opinion, that's a little bit of an overkill for a procedure that is performed through a 1-inch incision. I prefer spinal anesthesia, and then they also can be done with epidural anesthesia. Epidural anesthesia is the type of anesthesia that ladies get for childbirth. It involves a little catheter in the spinal canal. It's also very safe. Spinal anesthesia, it's even less than that. It's a little needle, a little shot of lidocaine in the back, and then the patient is numb from the waist down for about an hour to 3 hours. The great thing about a spinal anesthesia is that it relaxes everything below the waistline, so the penis expands and enlarges. When the patient goes back to the recovery room, there's no pain, and the risk of deep vein thrombosis, blood clots of the legs, is extremely unlikely with spinal anesthesia as opposed to general anesthesia where that risk is more significant. When the patient gets general anesthesia, the chemicals need to be taken out of his body for the patient to breathe on his own and be awake, and then the pain is felt from the penile implant, and so we then have to give patients morphine in the recovery room. So with spinal, the patient is a lot more comfortable and recover very nicely.